my channel. My name is Claire and today I'm making a video for Nurses.co.uk, so a big shout out to them for sponsoring this video. And today I want to talk about confidence as a student nurse. Confidence is something I've struggled with since the very beginning actually, because it really comes across if you don't have confidence, and there's a difference between being underconfident and overconfident, and sometimes they can get confused because sometimes people come across as maybe overly confident but actually they just have self-belief. So that fine line I want to talk about today, and just things I've learned along the way to make myself feel more confident throughout placement, and then because I'm ready to start my job now, which is terrifying, but ready to take the next step and to have a job and not be that student nurse anymore. So I want to talk about that. So the first thing with confidence is practice, and it always comes back to the more you do something the better you get at it. But with confidence, I feel like that's how you truly build confidence, is just by learning, by doing placement, by doing the hours, getting the practice, and the more practice you have, the more confident you'll become. And I think confidence is huge because it's so important for you as a student and as a nurse, but also your patients. I think if your patients don't feel that you're confident in yourself, that's very worrying. And I remember in first year I used to come across quite nervous, and obviously I look quite young but looked even younger 3 years ago, and patients would kind of say to me like, oh, are you still in school, and say stuff like that, and that would knock your confidence in itself. But I think they said things like that because I came across as so young and immature and not confident. So obviously you can't help how you look, and if you're a shy person you can't really help that, but I think being confident in your skills is huge, because you don't want to go into a patient's room and have to ask to change their dressing or something, and for them to not want to trust you. And I think that all comes down to your confidence and your confidence in yourself, and then they'll obviously start to maybe agree with you a bit more and stuff if you feel like you're confident in yourself. So my number one thing would be practice. With time, confidence will come. And also, like, if you don't know something, looking it up, researching in the background, because the more you know, the more confident you'll be in your abilities. Like, you don't often see lecturers not being confident because they've been doing it for so many years. They know what to do, they've been through it, they've had the experience. There's a reason why they're lecturing in the subject, is because they're experts at it. Like, they know what they're talking about. So just remember that it will come with time, but also actively try and improve your confidence, because it's not just going to happen overnight either. Another way confidence can be improved is exams. And this might sound strange to some of you, because it's like, oh, exams is when I feel the least confident, but it kind of comes back to what I was saying about making the effort to be confident, making the effort to make that extra move to get that grade. That will all add to your confidence. And then if you prepare well for things like exams, essays, which are really, really difficult, if you prepare well for them and do well, that will then improve your confidence. I would also say, while coming back to placement, so this is my third thing. So first, improve confidence with regards to placement, acting confident with time, it will come. Number two, definitely through exams, studying well, doing the best you possibly can. And if you don't do well, then at least you can say, okay, well, I need to improve because I tried my best and I still didn't pass, or whatever it may be. And third, when you're on placement, I used to find this so difficult because it's kind of asking for criticism, but it's not in a way. It's asking for things you can improve on. And sometimes people don't like to ask this because that everyone wants to think they're good at something, and yes, we all want to be good at things, but if you don't learn from your mistakes, or not even mistakes, your negative side or your downfalls, then you're not going to improve. So in placement, if I finish a shift or something and the nurse is like, oh, thank you for today, like, you did well, I'd be like, okay, like, but like, what can I improve on? Like, can you give me one thing that maybe I wasn't so good on? And they may be like, your confidence, which often came up, to be honest, in definitely the first year and a half, 2 years, just because I didn't like have self-belief that I could do it, which is really sad, but it does come down to that. And definitely hearing someone say that, you're like, oh, okay, so I really do need to work on that, because if somebody else is noticing it, then it's not just me, you know, secretly plodding along. It's the person assessing you has noticed, the person working with you has noticed, and if they've noticed, then the patients definitely have. So that's something to take into consideration, because it's easy not, you know, not wanting criticism and not wanting things to improve on. But if you don't know what you haven't done well, then how can you improve? So that definitely builds confidence, finding maybe your like weaker points and then working on them. And then, you know, maybe the next time you work with that nurse, you can be like, oh, so what did you think of me now? And they can think, you've improved a lot, you know, your confidence has grown, and that all has come with time, which is pretty cool. So I would recommend that if you want kind of like a point for placement. Yeah, and that's really helped me. I think self-confidence comes from inside you. It doesn't come from external things. So therefore, if we want to be self-confident, it doesn't matter whether it's in nursing or in life, I think working on your inner belief is definitely something that would be beneficial. And this seems like really wacky and maybe a bit hippie-ish, but it honestly will really help. So working on, you know, your inner feelings towards yourself, because if your inner feelings towards yourself aren't where they need to be, then your outer confidence is going to be portrayed like that. So how I improve my inner well-being, inner confidence, inner voice, definitely by meditating, by going on walks. Obviously at this situation at the moment, it's really difficult because there's a lot of isolation, a lot of loneliness, which is really hard, and I hope you're all doing as best you can with that. But honestly, definitely meditation, reading books, listening to music, going on a walk, just having time with yourself, and I think becoming happy with your inner thoughts will then shine on the outside. So that is definitely the biggest tip I can give you. Work on yourself, and therefore your external will come too. My battery is flashing, so I'm gonna have to wrap this up quickly, but thank you so much for watching, and I really hope these 4 tips have helped your self-confidence in regards to placement, life in general, really just your whole life, because it's not all just about nursing, it's really about improving as people, and therefore that will seep into all areas of our lives. So thank you so much for watching, and talk to you again soon. Bye!